may have heard things about collective bargaining. One of the problems that unions can cause when you're dealing with a city or school district or county is if you change the way people work, maybe ask them to do something different than they did before, you have to go through the union. And when I talk to school superintendents or city administrators or what have you, one of the frustrating things for them is if they want to do things in a different way, it's maybe more efficient or maybe would save money, the union says, no, that's a union negotiating thing, you can't do it. And given the crisis that we're in, Governor Walker wants the mayors or the county executives or the school administrators to be able to deploy their personnel as they see fit. So you're going to hear some people say that it's not a fiscal issue, but rest assured that collective bargaining can be very much a fiscal issue. And as Governor Walker wants the county executives and school administrators and city administrators to be able to operate their units of government as efficiently as possible, he wants to give them whatever flexibility they want. Sometimes in the past, it's been very difficult to deal with unions. People say, well, why don't you just negotiate with unions? I'll give you an example. On health insurance, which I realize now unions are willing to get in on, there are some school districts that may spend $23,000 or $24,000 a year for a family health insurance plan, and other school districts, because they go to a different carrier or maybe they self-insure, are spending $15,000 or $16,000 for the same benefits. Now, normally you would say if you have one district spending $23,000 a year and the other district spending $15,000 a year for the same benefits, why doesn't the district spending $23,000 a year just go to $15,000 a year? And that's because right now it's subject to sacred collective bargaining. And a lot of school districts have seen teachers say, we refuse to have the more or the less expensive plan even though it's the same benefits. And frequently those teachers, or at least the union in those areas, they say, we don't care if it's going to mean higher class sizes, we don't care if it means getting rid of some extracurriculars, we insist on the more expensive plan. And they have insisted on that maybe for a decade or more. So clearly, collective bargaining is not the way that you necessarily operate a school the most efficiently. And that's why I stand behind Governor Walker in considering collective bargaining a fiscal issue. And like I said, if we are going to have mayors or county administrators or school administrators deal with this cut in school aids or county aids or city aids, I think they need the ability to do this. There's one other thing in Governor's budget that is receiving some publicity but not as much, and that is in dealing with things like Badgercare or Medicaid. The second biggest part of our budget is Badgercare or Medicaid, which is health care, which the state provides for the poor or middle-class people who don't have other health care. In the last 4 years, despite the fact that we've been in a very difficult economy and we have less money coming in, the cost of Badgercare has gone up. And obviously, if you're trying to put together a budget and you're trying to cut costs in other places, it's not very good if the second biggest line of your budget is going up. One of the reasons Badgercare is so expensive in the state of Wisconsin, first of all, let me explain. Badgercare, in the year we are currently in, the federal government pays for 70%, and the state of Wisconsin pays for 30%. Next year, and we operate on a fiscal year in the state of Wisconsin, in the year beginning July 1st, we're going to go back to the old way in which the federal government picks up 60% and the state picks up 40%. So obviously, if you have the second biggest line of your budget, and right now the state is picking up 30%, it's going up to 40%, that by itself creates a problem. Now, a problem or inequity in Badgercare is that right now Badgercare, which is people who have government health insurance have, is usually more generous than most people who have insurance through their private company. It's more generous in the sense that you don't have a deductible. It's more generous in the sense that your copays are almost non-existent. It's sometimes more generous in that it offers coverage for things like glasses that frequently, if you have a private sector employer, they don't cover. Even the state of Wisconsin doesn't cover glasses. As the result, employers reported to me that when their employees get off the private sector plan and go on to Badgercare, they're going to doctors more frequently than they have been in the past. Governor Walker has asked for the flexibility in Badgercare to have his Secretary of Health go to the federal government and say, wait a minute, we're not going to offer every little thing under Badgercare, because Wisconsin is one of the most generous states in the country as far as what they offer on Badgercare and Medicaid. He also wants to have his secretary have the ability to ask for co-pays. And if you talk to healthcare providers, one of the complaints that they have is that sometimes people on Badgercare or on the government will kind of recklessly show up at the doctor all the time because it's not costing them anything. And I think Governor Walker feels, or I hope he feels, that if people have to pay a little more every time that they go to the doctor themselves, $10 or $20 or $30 or what have you, maybe they won't be running to the doctor so much, and maybe the cost overruns on Badgercare won't be as much.